Okay, if you're coming up on Medicare, or if you're already on Medicare, you're on one of these two paths. You're either on original Medicare, having Part A and Part B, and getting your insurance from there, or you've outsourced your Medicare and you're over on one of these Medicare Advantage plans. You're either on one or the other. And so we're talking about this today because I'm not convinced that the majority of our people could really pin things down and say, I'm here or I'm here. I mean, through experience. It's just, this stuff is confusing and it's coming at you from all directions. And people, when I ask them what they have, what they're getting, what they like about it, what they don't like, I get a little of this, a little of this, and it's just kind of a big mixture. So I'm going to work today at giving you some clear direction. Is you are either here or you're here. Or if you're just coming up on Medicare, you need to make the decision whether you're going this route or this route. It's that simple. Now, original Medicare is just what it says. It's Medicare like it's been from the beginning, where you have Part A hospital and Part B doctor, and you get your insurance directly from the government. Medicare is going to make payments to the hospitals and doctors on your behalf. And you've got deductibles and co-payments, big deductibles and co-payments. In fact, Medicare only covers 80% of all the Part B charges and original Medicare, and you've got 20% that you would have to pay on out of your pocket if that's all you had, and that's why people buy Medicare supplements. So people, when you put original Medicare A and B together with a Medicare supplement, you've got very, very good coverage, and you're paying for it. A Medicare supplement is going to cost you between $100 and $200 a month, depending upon where you live. And this kind of coverage, you know, you're going to enjoy. You're also going to need to buy a separate Part D drug plan, and that has a plus and a negative to it. The negative is you got to pay the premium for it. The positive is you actually get to pick your Part D drug plan. And a real positive with original Medicare, Part A and B and a supplement, is you don't have any networks to deal with. You're in one big gigantic network. It's called Medicare. And you can use it at any place that takes Medicare, anywhere in the United States. So if you get seriously sick and you want to go to a research hospital, if you get, like you're in our area here in North Carolina, we have Duke locally, and my wife's just been through a very difficult disease and very expensive, and of course we wanted to go see the best, and so we went to the Duke Cancer Center. And you know, you can't do that on a plan where you have networks unless you've thought about all this in advance and you set your whole plan up. With original Medicare, you can go where you want, as long as they take Medicare, and your supplement's going to go along for the ride. Now, talking about how good this is, it's expensive, and it is going to make this sound maybe like it's not so good, and that's just not true. So what you're doing here with Medicare Advantage is the government, they offer private insurance companies the opportunity to accept Medicare patients, to provide them their insurance coverage, and they're outsourcing Medicare is essentially what's going on here. Is through like Humana or United Healthcare, Aetna, Cigna, is you're now going to get your Medicare. And there's a bunch of regulations on that, but they're going to be sending, the government's going to be sending Medicare, they're going to be sending Cigna or Humana or whoever you have a check every month so that they don't have to pay claims on you. That's their job. Okay? Now, most of these plans include a Part D coverage, so you don't have to pick it, nor do you have to pay for it. It just comes with the plan. They also have a zero or low monthly premium, with many of them these days having a zero premium. So you're trading the zero premium for the $100 to $200 a month, and the Part D coverage premium over here. That's very attractive to a lot of folks, especially if they're healthy. And then what you're doing is you're accepting networks. And it's not like somebody tells you where you have to go. You have a wide variety of these networks, and you know, we offer a multitude of plans, so we can sit down and set your Medicare Advantage plan up in such a way that the networks will work for you. But they're still there and you have to deal with them, and whereas over here, you got no networks. So these are the two clear paths of Medicare, and the important thing to understand is you're either here or you're here. There's no in between or a little of this, a little bit of that. I'm Hans Scheil, and I thank you for listening.